Talk about the EMS ad hoc committee final report.
Thank you, Lisa. I'd invite Bob to come up and join us, and obviously Andrea and Jeff and Lisa all and Larry participated in this ad hoc committee, so I would ask everybody to kind of chime in. And, we don't really have a formal presentation, it's just going through the report and kind of having some discussion on some of the items that have come up. So what you
like it, Phil? Phil, you're gonna like it. I'm gonna like this. Okay.
Phil likes all my presentations.
That was the driving force. We just wanted to put something together so it looked like.
How much time did you give Brian?
What?
How much time did you give Ryan?
I said 20 minutes.
He took it instead of me, so it wouldn't run over. It won't be death by fall.
The only one more long-winded here than me is Bob. So formally, the ad hoc committee was represented by 3 legislators, Legislator Morahan, Legislator Mellenbeck, and Legislator Verkler. In addition to them, we had several community members and EMS providers and leaders across the county were involved. We had myself, Bob, Jen Marchione from Bob's office, Josh Levesque, the Chief of Lewis County Search and Rescue, Bob Mullen, Town Supervisor in Lowville, Scott Doyle, Town Supervisor in Denmark, Marcy Teal, the Chief Nursing Officer at Lewis County Health System, Bobby Call, the Director of Emergency Preparedness at Lewis County Health System, Jim Devers, I believe he's still on the board actually at Lewis County Search and Rescue, but he's a retired EMS provider in Lewis County with a lot of years of experience, and Larry was on the board ex officio as the chairman. So you can see on page 2, a lot of our members, in addition to their roles as county leaders, are also EMS providers in their own right, or retired EMS providers. The authorization for this committee goes back to January of 2022, as one of the goals that the Board of Legislators wanted to address during that time was the continued shortage of EMS providers in Lewis County. Bob actually gave a presentation about this topic in 2021, which kind of spurred the board into thinking that this is something that the county needs to take a larger leadership role. So over the course of the last 18 months, the committee has met 4 times formally, and Bob and myself and Jen and Jeff and other people have met several other times outside of those committee meetings. And basically what we have here is some basic research on how things work in Lewis County and what are some of the challenges. And then there's a series of policy recommendations that the committee is asking the Board of Legislators to consider. So just basically in Lewis County, there are 6 EMS agencies that cover the county: Harrisville, Beaver Falls, Turin, Lyons Falls, Constableville, the J.S. Coster Hose Company, which is Port Leyden, and West Leyden, and of course Lewis County Search and Rescue. We also have 4 agencies that serve Lewis County from outside the county. That is Carthage Area Rescue, Natural Bridge, Boonville, and Camden. Last year we had 2,600 EMS calls in Lewis County. We know that Search and Rescue's paid staff covered about 1,500 of those, which means 1,000 calls a year are covered by purely volunteers in Lewis County. So obviously a large number for our it's the other way around. 1,500 calls per year are handled by our volunteers. Really, if you look on page 3, you can see the impetus of this. The reason why we put this committee together is the number of total providers in Lewis County is down pretty significantly since 2012. And some of the folks that were involved in times before 2012 can attest that if we were to look back 25 years, the numbers are probably down even more from the number of volunteers that we used to have. So the central thesis that our committee came up with is that the best way to move forward in Lewis County is actually to try to support the volunteers that we have. One of the big reasons that volunteers are kind of drying up in Lewis County is the time commitment required. Each call we've figured out is about 4 hours per call for an EMS provider. So if you're a volunteer taking time away from your work or your family on nights and holidays and weekends or during the workday, that's becoming increasingly challenging for folks to make that commitment of 4 hours per run. In addition, the recertification process and in-service training process has become more burdensome. The state regulations, in a lot of ways, potentially are a good thing. When an ambulance shows up, you know that you're going to have a certain level of care. In other ways, though, it's an incredible demand on volunteer providers to be able to meet those hours of training. Bob, can you kind of expand a little bit on that?
So when you hear the number 4 hours, it's not 4 hours in the back of an ambulance per se for that particular transport. You've got preparatory time for getting to the ambulance station, getting in the ambulance, driving to the call, actually doing the call, and then there's the time afterwards for doing the electronic pre-hospital care report. Back in the old days, that was a triplicate, just a piece of paper that you just wrote your notes on, and that was the end of it. Now they're actual SOAP notes that are actually sometimes more in depth and the same quality that your average RN would be doing in the emergency room. And there's even more points on top of that. And all of that just takes more time, but what it does do is it generates data. In order for anything to move forward, you need data as to what you're doing well and what you're not doing well. So that's where that 4 hour mark comes from. The quality of care and the number of skills that basic EMTs are doing now has virtually doubled in the past 5 years. Acquisition of 12 lead EKGs, which was unheard of before. That was a strictly paramedic skill. But they're not interpreting them. All they're doing is acquiring them and then sending them to the hospital so that the hospital can just say, okay, I see something in this, you shouldn't bring them here, you should go to a STEMI center and pick up ALS on the way. So it's getting a better field quality of care, and there's just a tremendous increase in skills that the EMS providers are able to do.
Yep. So one of the other contributing factors towards the time commitment increasing is interaction with the hospitals, which has really changed. Before COVID it was changing, and now it's, post-COVID has changed even more. It is not uncommon for a single EMS call that, normally would have gone to Lowville, Watertown, or Carthage. They're getting diverted oftentimes where emergency rooms can't take additional people or don't have the staff. The switch of Lewis County and Carthage to critical access means the amount of calls we can take is different. So it's not uncommon for these calls to be going to Syracuse, Utica, Albany, Binghamton, Westchester. When we were talking about this in committee, it's crazy the places that some of our providers have gone to on what you think is a simple call when your radio goes off. And then once you get to the emergency room, I learned about this thing called wall time, where you have brought the patient to where he or she needs to be, but the emergency room isn't prepared to take them. And so our EMS providers, again, majority volunteers, are spending their time in the emergency rooms continuing to care for the patient as we wait for the hospital to take the handoff. And that's time that has increased over recent years as well.
And that's not to be misconstrued that we get that particular problem at Lewis County General, because that's an exceptional rarity. We might have to wait for them to prepare a room, but if we recognize that there's a heart attack going on, or we recognize there's a stroke going on, they need to go to those specific centers, and that's where we end up with the wall time. That's where we end up with 40-minute wait time standing in the entrance way of their ER, just waiting to get in.
Mm-hmm. And then one other thing the committee pointed out is that the lack of an urgent care in Lewis County creates additional EMS calls. People that might have popped into an urgent care or driven themselves. Now, if they've got to go to the emergency room, or they've let something that could have been preventative become more acute because we don't have an urgent care, then that has an effect on EMS calls as well. So all that is to say that the time commitment of our volunteers is what we've identified as the biggest factor. It is the amount of time that they have to spend to do this service for their community for free is becoming unreasonable, and a lot of people are deciding that it's not worth the time to do it. So that was our main thesis. We did look at other models across New York State. There are lots of counties that are doing what we have done, which is kind of take a county level leadership role in looking at EMS models and how they could change, how they could be done differently. Several counties have created a new county department, like just like Sheriff's Department or soil or real property. We have a new department that is EMS, where they employ full-time EMS providers and supply them with ambulance and everything they need. That's obviously the most expensive model that you could choose. A lot of the Finger Lakes counties that are smaller in area, you know what I mean? They've got maybe similar population to us, but they're about half our size in terms of square miles. That might make some more sense for them. However, for us, two factors kind of contributed to our thinking that a county-wide district or a county-wide department would really not be as effective as you might think. The first is the sheer size of Lewis County. If you did some type of centralized model where we placed either county personnel or a county-wide district personnel at centralized locations in the northern, central, and southern zones, you really can't justify full-time 24/7 coverage in the northern and southern zones. There isn't enough call volume to justify having a full-time EMS team, driver and paramedic, there all the time. That's issue number one. Issue number two is that a majority of our calls are Medicaid and Medicare patients. That means the cost that you're paying to have someone there full-time to really not make a lot of runs is compounded by the fact that when you do make a run, the odds are your reimbursement or payment for that run is going to be less than what it costs you to even roll the ambulance out the garage. The third factor is that if you're in the southern zone, for example, you could still easily be 20 to 25 minutes away from some parts of the county, northern zone too. So even if you did have an EMT that was ready to go, paged out, and could hop in an ambulance immediately, they would still be quite a distance from some of these calls. So the philosophy that we came up with, that I would say kind of came from Jeff, but everybody got on board with, was that the best case scenario for Lewis County, a place like Lewis County, is still someone from your community that lives or works in your community is able to get paged, hop in an ambulance, and be at your house. It's personal care, it's someone that you know, and also it's close, close, and they're able to get there on time. So, and then Bob pointed out that with a centralized model, 10% of our events are multi-casualty events, so 2 vehicle crashes, or a vehicle with a rollover where you have 2 or more casualties. If you had a centralized type system where you had one provider that was ready to go, you would still need the volunteer network and other agencies on those multi-casualty events, right? Because one ambulance is not enough.
That would be 10% of our trauma cases.
Okay.
Would be, which would be motor vehicle crashes. And now we're starting to run into ATV, UTV crashes, and those are extremely remote. And there again, that's just compounding more hours on the road. So it wouldn't work with a 3 ambulance model in that there would be no mutual aid. We'd be starting to call other counties to draw them in and taking away their resources to cover our issues. So just leaving our current network in place is the best model.
So if our thesis is that the current model of volunteers is what would work best for Lewis County in the future, then the question becomes, how do we support those volunteers and how do we grow the base of volunteers that we have? And so that leads to page 5 and a series of recommendations that the committee has made. So like I said, the goal number 1 that the committee set is to support EMS providers by offsetting the personal cost of serving their communities. And the first policy recommendation that the board, that the committee has made is that the county will reimburse EMS providers for each call. What we're proposing is a $40 reimbursement per call for EMS providers and a $25 reimbursement per call for volunteer ambulance drivers. This would be something that the county would theoretically cover the cost of. And if there's 1,500 calls a year covered by volunteers, and you have one EMS provider and one driver, that cost of the county would be $150,000 a year. This is a conclusion that other counties in rural areas of the state have come to as well. However, there are legislative barriers. The state has issues. We were just on the phone earlier today actually with an EMS attorney, a gentleman named Brad Pinsky, who was chatting with Joan and I. And Joan, maybe you retained some of the legalese better than I did.
She stepped out.
Okay. Well, two issues. One is workers' compensation. Right now, if you're a volunteer and you get injured on the job, you're covered under the volunteer workers' compensation firefighter EMS fund, which I'm sure isn't called that, but something like that. And then if they, we're going to become, paid employees and not volunteers, then if they got injured and got seriously injured, they would only be entitled to the small amount of money that we were providing them, and maybe they got injured where they couldn't work for quite some time. So the risk on the volunteer EMS providers on that front would be they'd be taking on a larger risk. The second issue is that the state has minimum wage laws, and so if they become an employee and we pay them $40 per run, and the run takes 4 hours, that's $10 an hour. Current minimum wage is over $14. So there's some challenges. The attorney that we chatted with thinks that Lewis County would be a great place for a pilot legislation for the state to give us authority to kind of move forward with something on a trial basis. We're the perfect size, and we've done the homework to justify the state kind of giving us the permission. We're not the first to come across this problem, but maybe we could be leaders in the state in terms of trying to come up with something that allows us to do this. So as of right now, we couldn't implement this policy tomorrow. However, I think we need to add our voice to the rural counties in the state that are trying to push this idea of a stipend. So something potentially for the future.
Frank, can I ask Bob a question? Bob, there was an article, I think it was in the Watertown Times this weekend, but it was dealing with EMS calls and EMSs going out. And kind of the crux of it was they were going to take the place of a emergency room or urgent care center. Have you?
So that's called community paramedicine.
Okay.
Yep, and community paramedicine has to be regionally approved. And we've looked at some models, and there are some models in our area. In Jefferson County and St. Lawrence County, they are doing community paramedicine.
Oh, okay.
And that is going to be a paid ambulance agency taking the lead on that and putting a paramedic in the field to do follow-up care, in-home follow-up care. When this first came out, there was a lot of knee-jerk reactions from the nurses' unions, etc., stating, "Oh my God, they're going to take our jobs." Home health nurses didn't like it, so on and so forth. And what it did is, after working with them and actually working with those groups, it actually showed that it actually enhances the field care and the level of care that those patients are getting. And it's not always about being paid for doing something. It is actually about patient care. So we do currently have one ambulance agency in the county that would be able to do community paramedicine. However, I don't believe at this time that they're postured and ready to do that.
So that would be a different burden again.
It would be, and it would be a different structure.
Thank you. I hadn't heard of it until then. I
Yep.
thought I'd ask. Thank you.
So a little disappointing that we're not going to be able to execute that first policy right away, but definitely something that we can work on. The second policy that the committee is recommending is that the county makes a one-time payment to the EMS agencies for capital expenditures. We toss this one around quite a bit. The philosophy is that a lot of these volunteers, in addition to the time that they have to take on calls and getting their certification, recertification, they also, many of them have to do fundraisers and try to scrimp and save in order to just keep their rolling stock, their ambulance and their equipment up to date and able to get out the door. So if we could alleviate some of that stress and alleviate some of the time burden that they have to spend on fundraising, that would be something that could help retain these folks so that they don't get burned out quite as easily. The number that we had come up with was $245,000, and basically it's $17,500 per ambulance. So Search and Rescue has 7 ambulances, so they would be eligible to receive $122,500. Every other agency in the county has 1 ambulance, so they would receive $17,500. We talked a lot about different models of how we could help with these capital expenditures. We thought about doing a program where the county buys, replaces an ambulance every year, which would be about $250,000 to $300,000 a year per ambulance. The problem with that is there's 8 or 6, whatever, what are we up here? 8 ambulance agencies. That would mean the Board of Legislators in 2031 would have to be on the same page as the Board of Legislators today. Otherwise, Lions Falls gets a new ambulance and Harrisville never does. So that's a challenge to commit to something that far in the future. We don't know what the financial situation or political makeup of the board is going to be in the future. The second thing we thought of was kind of enfolding these ambulances into our capital program. Okay, so the county more or less is the owner, and we kind of lease them out to the agencies, and we manage the fleet. That's really talking about an incredible financial commitment for the long run. Again, is not something necessarily, and also it kind of erodes the autonomy of those local agencies as well. So what we settled on for now was a one-time, and then if boards in the future want to continue that, they can. But we're not, we're not buying one ambulance for one agency. We're distributing the wealth evenly every year. So that was kind of the thought.
Has a question.
What about the 4 outside agencies that you identified here? Nothing for them?
Anyone want to summarize our discussion on that?
So, our focus was on the Lewis County agencies, and although they do service Lewis County, and some of them actually have a large area within Lewis County, we needed to keep our focus on Lewis County. If we want to increase that number and give a portion of that 17,000 to those associated agencies, I think that we could rewrite something, but far be it for me to make that decision. We had to focus on our Lewis County agencies because it's Lewis County tax dollars.
I think that's what it came down to, Phil, was, I'm trying to recall the discussion, because we definitely talked about this.
We did.
I think it was hesitancy to, provide funding to agencies that are not located in the county.
And I understand that, but in my neck of the woods, Natural Bridge does a lot of calls. They go by me, that's how I see them, and I wouldn't be surprised at covering at least half of the calls. You probably know better than me, Bob, but they cover a lot of calls, and actually Carthage does too. So it would seem like something to show appreciation or whatever.
And, after we talked about that at committee, that was something that we had to list an initial presentation to take care of our ambulance agencies within the county. If we wanted to expand on that, I'm sure that we could probably, look at it again and figure out other alternatives.
I certainly would advocate for a full vote on something like that. Not 17.5, but
One of the other things that we talked about was providing X amount of dollars per town, so then they can decide if, for example, Diana is half served by Natural Bridge or Carthage, they can divide it up, however they want. So we can talk more about this.
thank you.
The next policy recommendation, again, this is all to serve the goal of support our volunteer EMS providers by offsetting the personal cost of serving their communities. The county will manage, the next policy is the county will manage a contract for countywide EMS medical director. This is one that kind of came up, you guys might recall that the county employs a medical director for a lot of our departments. DSS has a medical director, Public Health has a medical director, Dr. Palmer had to step up big time during the pandemic. In fact, all of the orders, the prescription more or less for the vaccines in Lewis County were under her order. So it's a job that sometimes doesn't require a lot, sometimes it does. And every agency, every EMS agency has to have a medical director. And a lot of them have struggled to keep a relationship with someone. We had someone in place countywide for quite a while, but when the county health system switched to Delphi in the emergency room, we don't always have a consistent doctor present there that can be that liaison and that consistent voice with whom our agencies can work. However, when this issue came up in our discussions, Bob got to work right away and actually has formed a new relationship for a countywide medical director that will handle all the agencies in Lewis County as long as they sign off on it. And they don't have to worry about managing that contract themselves anymore. And I believe Dr. Mathis is who he came up with.
Dr. Tim Mathis is actually medical director for numerous agencies in Oneida County, so he's very familiar with this process. He's a great EMS advocate. I would put him right up there with Dr. Harney, who was our EMS director for years. And he's definitely engaged with the community. A problem with switching from Dr. Howland sooner than what we did, because Dr. Howland's our former medical director, the problem with that was we couldn't find somebody to make a commitment to Lewis County. And I know that sounds a little rough around the edges, but if you're just going to be here for 6 months and move on down the road, that's changing, that's paperwork, that's more work for these agencies over and over again. So getting Dr. Mathis to sign on was a big plus to a lot of these agencies, and it gives them stability.
We pay, we have a contract for payment, a small amount for our medical directors for DSS and public health. And so, knock on wood, Dr. Mathis has agreed to kind of do this for us at this point, kind of pro bono. However, the county would commit, what we're asking is the county to commit to kind of matching that same type of stipend that we pay our other department medical directors for these EMS agencies in the future.
Dr. Mathis is Delphi?
Dr. Mathis is a Lewis County general employee.
Oh.
I believe he's the new medical director for the year.
Yeah,
I
he
would
is
defer to Jeremy for
contracted
that.
through Delphi
Yeah.
as our medical director.
The last policy recommendation under supporting our volunteers is the county will increase the real property tax exemption for volunteer firefighters and EMS providers. Is something that this committee or the Board of Legislators has already discussed in depth with Candy Aiken. She presented a few months ago that we're not eligible to change that policy until 2024, but my recollection of that discussion with the board is that everyone was in favor of doing that. So when we're able to make that change, we will, and that'll allow us to write off 10% of assessed value without a cap for the primary residence of each volunteer EMS provider in Lewis County. So it's hard to put a figure exactly on how much that's going to cost. It wouldn't be an expenditure, it would just be foregone revenue that we would not collect. So not something we have to really necessarily budget for, but we just have to be aware that there is a cost associated with doing that. Okay, that kind of concludes the goals of supporting the existing volunteers. The second goal was to increase the number of volunteers in Lewis County. We're on page 7 at this point. The policy recommendation, the first one for this is county will assist BOCES with the implementation of a new 2-year EMS program for juniors and seniors. Bob and I have had really great conversations with Stephen Todd and Jeff Ginger at BOCES. They have actually stood up their own committee, the BOCES EMT Advisory Committee, and they have met a couple times. What they're asking out of the county is in order to launch this program, they'd like us to help cover the upfront capital costs. So they'll cover the cost of the instructor, they'll cover the cost of running the program on a day-to-day basis, but there's a lot of training materials and medical supplies and stuff like that that the program will need to get up and running. So they've made a list and they've met with Bob to look over that list, and it comes in around $60,000 of materials. Bob, I'll let you expand on that.
So when we initially had our meeting, we found out that they actually had a CIC on staff, which is somebody who can train EMS providers. So already certified, already paid by them, already engaged with them. Teaches a different style class right now. When she was talking about getting this thing up off the ground, she was talking about, well, some ambulance agencies have expired items on their vehicles that they need to take off, and we'll collect those and we'll use those in class. That's great for bandages and stuff like that, but when you're talking about electronic devices, like I said earlier, the basic EMTs are doing acquisitions of 12 EKGs. A cardiac monitor is $45,000 to $60,000 by itself. So a cheap one is going to be in that price range. Last thing you want to do is train a new EMT on something that's 40 years old, that when you turn it on, it shuts off immediately. You'll just have a continuum of challenges, and it may be discouraging to them. So putting the appropriate equipment in their hands early on, stuff that works and works well, and it's many other things. It's traction splints that are $300 a piece. It's KED, Kendrick extraction devices, that are $600 a piece. It's things like that that they're going to be putting their hands on that are new, that aren't going to be broken and used from ambulance agencies. And that's just going to help enhance the class.
The next, so this is very exciting. We're hoping fall of 2024 is when this program will get off the ground for the first two-year cycle. Next policy recommendation is we support new EMS providers by providing reimbursement for classroom materials such as textbooks, workbooks, and study materials. We already started doing this. In fact, some of the towns have already started doing it as well, Denmark being the leader that started doing this. So any new EMT or provider that is looking to go through the class, the county will provide their books, study materials, and I don't know what else they apply for, but since unfortunately we haven't had a lot of new people, the cost is relatively low, only $5,000. But if we had 40 new people, our cost would go up.
Yeah. The book or the e-book, it runs around the $100 to $150 range, and then simple little thing like a stethoscope and a blood pressure cuff would go a long way, and that's an expense of like $30. So it's really not a heavy lift, but it's those little things that go a long way towards supporting volunteer EMS agencies, so they haven't got to go do a chicken barbecue to raise money to be able to buy that book, or put additional financial strains on those smaller agencies.
So those are the policy recommendations. If you turn to page 8, you'll take a look at kind of the preliminary budget that we put together. What we're talking about is $470,000 basically in 2023 and $160,000 per year thereafter. However, obviously a large portion of that is trying to get off the ground the paying of our providers. And that's about $150,000 a year. If we're not able to find a way to get that off the ground, then obviously that commitment, the financial commitment, is much less. But you can see, kind of how we've laid out each of those programs that the committee has put together. So the conclusion of the report is, basically, to reiterate our thesis, a lot of counties across New York State have really fundamentally changed the EMS model in their communities, whether the county is taking it over outright or setting up a county-wide district where there's a separate taxing authority that is supporting these agencies. Either way, that's a significant change from how we do things here in Lewis County. And the committee felt that to the extent possible, the best thing we can do is try to maintain our volunteer network. That's the best way to get care quickly to people's homes. It's the best way to make sure that we have mutual aid during large-scale events. And it's cost-effective, compared to really starting up a huge new agency or tax district. So that was basically the conclusion that we came to, and if we can implement some of these policies, the committee feels that we can, hopefully stabilize that number of providers in Lewis County. Last note, some people to thank that were not on the committee but definitely stepped up to help us. Stephen Todd and Jeff Ginger at BOCES, Joan McNichol, Candy Aiken, Cassandra Mosher, and of course all the folks that work in EMS, volunteers, and the folks that are paid in Lewis County. We're very grateful for all that you do for our community, and we appreciate your service. That's it.
Thanks, Ryan. Yeah, it was, I think, very robust discussions at all the meetings, and this is a robust recommendation. I hope that we can implement the first, but if not, then we at least have started this discussion and hopefully continue it. This is nothing, unique to Lewis County or to just EMS volunteers down everywhere, so I do think this is a good start, I guess we'll say that, so.
Can I add one thing?
In 30 seconds.
One thing I didn't mention is probably my favorite statistic in the whole, that I learned throughout this whole process. In Lewis County, for every one fire call, there's 6 EMS calls. Okay, 6 to 1. And I certainly would not advocate for any funding being taken away from our fire departments, because they have a lot of similar issues with volunteerism and their budgets and all the time and effort they have to put in. But if you look at where the resources flow from our municipalities, it's disproportionate to where the call and need is in our community. So that's something that, as you guys are out at your town board meetings, something to keep in mind.
But I think it's partially because of, you can have a fire contract, which is required. An EMS contract is not. It's more of a state policy, but
Yeah, we glossed over that, but it is in the report. To provide EMS at the local level is not a mandated service. The state mandates that towns and villages, municipalities have to have fire coverage. They do not mandate that you have to have EMS coverage. So I think most people would agree that it pretty much is a mandate, or it is a necessity, but legally it's not, right, Jeff?
correct.
As Lisa had stated, it's not unique to our area. In fact, in 2016, our regional EMS council chair came to Lewis County and all of the other associated counties, which is Jefferson County, St. Lawrence County, and Lewis County. And she did a study to find out how many EMS providers per ambulance agency. And she went and she visited each one, and her findings were actually shocking. There are some smaller ambulance agencies, and it's not just unique to Lewis County, it's Jefferson and St. Lawrence County as well, that are literally hinging on one provider. In other words, if that one provider decided, I'm not going to renew my card, I'm done, that means that ambulance agency would fold because there's no one else to do it. So that was a startling discovery that she made, and things have improved, but they haven't improved to the point to where things have stabilized. So by trying and at least bringing this to the public's attention, this will help stabilize EMS, or take strides towards stabilizing EMS within Lewis County.
Absolutely.
Thank
Any
you.
other questions for Ryan?
Does this committee need to make a motion to move this forward, or what way on that?
Well, there's 7 or 8 policy recommendations, and at least one of them can't be done right now. So if there's any of these that stick out to you today as things you want to move forward right away, you can do that.
Well, why don't we move the whole package, and then if we have to amend that one part, we can.
Yep.
How about
I was going to say,
you
can we do that,
move
Joan?
to, how about you move the package forward upon review by the county attorney as to what the board can take action on. All right.
I'm good with that.
Okay, I'll make that motion if I can get a second. Anything else? Then I think we can move on to